universities. So if you have any questions, feel free to drop it in the chat box below, or you may visit the university booth directly after this session. I have dropped the booth link in the chat box. So over to you, Catherine.
That's great. Thanks, Cynthia. And good afternoon, everyone. Lovely to see you today. So yes, as Cynthia mentioned, I'm going to talk about studying physiotherapy at an accredited university, which Manchester Met is accredited in Singapore for physiotherapy. So just to give you a bit of an overview, we are top 10 for physiotherapy in the UK. And on the course, you'll spend a minimum of 1,000 hours on physiotherapy placements within a clinical setting. And then you can spend your final 4-week placement overseas if you wanted to. So our course is 3 years, and it incorporates the core values of the National Health Service Constitution to really help you prepare for the challenges of working as a physiotherapist in a modern practice. So you'll learn how to assess what people need and identify their problems. We'll help you to understand how to set treatment goals and then determine the approaches that provide the maximum benefit for your patient. So to teach you essential clinical reasoning skills, we use real patient case studies, and this gives you the opportunity to try out your practical skills such as joint mobilizations, massages on people in your class, as well as on patient simulators as well. So in the first year, you'll build a really strong foundation of professional practice skills. Your introductory units will cover musculoskeletal, cardiorespiratory, and neurology, all in detail, along with a practice placement to observe and participate in the management of patients. Year 2 has 2 units of study. The first is delivered on campus, and then the second is your placement unit. And then in year 3, you'll study 4 units with 1 placement unit, which consists of 2 5-week placements, and then 3 academic units. And they focus on things like evidence-based practice, the transition to professional practice as a new graduate, and then research and critical thinking skills as well. The final unit in year 3 is a practice placement, and that's organised by yourself, giving you the opportunity to choose a specific area of interest you might want to take, or as I say, you can take your placement overseas if you want to. So a little bit more about placement options. We do have a dedicated placements team to help with managing and negotiating our placement partnerships. Placements that we arrange take place mainly within NHS institutions, but there are a few placements within private healthcare settings as well. So in the first year, you'll go on your first placement at the end of year 1. You'll attend a short observational placement in a clinical area of your choice. So how that works is you'll shadow a registered physio and get to see the theory that you've learned in the classroom put into practice. In year 2, you'll go on 3 clinical physio placements, and these are organised by Manchester Met and start in the spring term and end in the summer. So each placement lasts for 5 weeks. And you'll work under supervision, but you'll have your own patient caseload. So to help develop your physiotherapy skills, your placements during year 2 run back to back. That means that you can use the knowledge that you gain each week, and it really helps build your confidence as a physiotherapy student, developing over the weeks throughout your placements. And then in the final year, in the autumn term, you'll complete 2 5-week clinical placements, both organised by our placements team. And then once you finish your exams in the summer term, you'll go on your final placement for 4 weeks. And as I say, you can choose the location of this final 4-week placement. Some physio students go overseas, some choose to stay in an area or trust in the UK where they can see themselves working in once they're qualified, but it's really up to you in terms of what you want to do and where you want to do it. So in terms of the type of things you'll do, clinical placements are held in locations in and around Greater Manchester. So that can be NHS hospitals, private hospitals, community settings, outpatient clinics, or you could be working in our own physiotherapy clinic that we have on campus. But the main crux is you'll be dealing with a really wide range of patients, including people with learning disabilities, mental health issues, women's health, paediatrics, accident and emergency, intermediate care, rehab, and that can be neurological, cardiac, or pulmonary patients, oncology, intensive care. So it really is really diverse to try and get you that exposure to a wide variety of patients throughout your placements. So how do you apply for the course? Well, we'll talk about the academic profile in a moment, but in addition to the academic ability, you do need some work experience, some caring experience, And demonstrating an insight into what a physiotherapist actually does is really important. So we're looking for a commitment to the subject and evidence of humanity, such as things like empathy, a caring attitude. That can be demonstrated through charity work or support of other people, essentially putting other people first. Your personal statement's key, and then after that, your reference says that you're expected to achieve the appropriate academic qualifications. And all offers that we make are subject to criminal records bureau checks and medical health clearance from occupational health at the university itself. So what kind of skills do you need to become a physio other than your academic qualifications, which we'll discuss shortly? So our academics are looking for the qualities you see here, because working with people requires more than just academic knowledge. You'll be working with patients of all ages, from all backgrounds and cultures, and with people who may be in very vulnerable positions, who may be recovering from life-changing injuries or conditions. So the qualities that you see here are really vital for those students who are entering the caring professions. It's not just your academic profile, it's about you as a person as well. So in terms of entry requirements, we do have a foundation route available. So what's really important for coming onto physiotherapy is your knowledge of biology. Now, if you haven't had the opportunity to undertake biology during your schooling, we do have a foundation route available. And that requires at least a C in 5 O-levels, including maths and science, to get onto the Science and Engineering International Foundation Year. And that's run at Into Manchester, which is our pathway provider at the university. And you need to have then passed that with BBC, and that needs to include B in biology. If you're coming to us from A-levels, you'd need 3 A-levels with minimum grades of ABB, and that would need to include a biological science. And so that can be either biology, human biology, or sports science. You'd also need O-levels with C, including English, maths, and a science. If you're coming to us from the IB diploma, we ask for 29 IB diploma points. Or if you're coming from a Polytechnic diploma, you'd need a GPA of 2.5, but you'd need biology content included within that. In terms of English, we can accept O-level English with a B, or alternatively IELTS 6.5 with no element below 6.0. As I mentioned earlier, your personal statements are really important. We need to see your clear reasons for choosing your physiotherapy, your work experience or your shadowing experience, or demonstrating that knowledge of physiotherapy. Essentially, we need you to understand what you're getting into in terms of understanding the role of a physiotherapist and the career that you're setting yourself up for. We also like to know about your outside of work or your school interests, particularly looking at those skills, those desirable qualities, and how you can link into those. So things like teamwork, leadership skills, but importantly, your ability to empathize and that evidence of a caring nature is so important. Not just for physio, but for other health profession courses as well. As I say, your academic qualifications are just one part of it. It's also down to the desirable qualities as well. And that's one reason why we interview everyone. Also to give you the chance to meet us and see that it's the right course for you. But we score all our interviews to make it fair to everyone. So the interview is just 15 to 20 minutes. As I say, it's scored against set criteria. And with the interview, we're really looking for your insight into physiotherapy. And as I say, the role of the physiotherapist within the health service, your skills as a learner, and your personal values. So as I say, that demonstration of empathy, your respect for patients' rights and dignity, and good interpersonal skills as well. But it's also a good opportunity for you to ask any questions you might have. This is your opportunity to meet with our academics from physiotherapy, and they will likely be the teachers the lecturers who are going to be teaching you throughout your course. So it's a really good opportunity for you to ask any questions that you might have. All students also have to undertake a health screening to ensure that they're able to cope with the physical aspects of the profession. And that's to make sure that your health isn't a barrier to achieving the programme learning outcomes or your eligibility to register with a professional body. So that requires a completion of a health questionnaire, and that'll be sent with your offer letter. We also ask for a disclosure and barring service check, which you can complete when you arrive in the UK. So that's it for the undergraduate course. We do also offer a kind of postgraduate level courses. We've got 2 routes available. We have the MSc Physio pre-registration course, which is for students coming to us from maybe a degree in biological sciences, sports therapy, nursing, psychology, and wanting to move into physiotherapy. And then we also have an advanced physiotherapy MSc for students who have already taken a bachelor's in physio, have registered and have clinical experience as therapists, but are wanting to get more experience. So there's a couple of postgraduate options for you as well. Now, just to give you a bit of more information on what it's like to study physiotherapy with us at Manchester Met, this is our award-winning Brooks building, and that's home to the Faculty of Health and Education. And we've got superb specialist facilities within this. It's a community campus, so the ground floor is open to the public. We've got sporting and social facilities, cafes, green spaces for individual study, meeting rooms, informal group working. And as I mentioned earlier, there's also a physiotherapy and acupuncture clinic, which is open to the public as well. And then in terms of our facilities, we have 7 separate physiotherapy practical rooms, and they allow students the opportunity to learn those practical skills and techniques during simulated patient scenarios. So simulated patients are real people trained to portray different conditions. So they're trained to be portraying patients and to give feedback to learners on their interactions with them. So simulated patients are involved in simulation-based education, and that really helps provide a safe environment for the patient and the learner in which to rehearse things like patient-centeredness and other critical aspects of healthcare professionalism. The physio practical rooms also include an electrotherapy area and a physiotherapy gym. All of the rooms are equipped with the technology and equipment required for physiotherapy interventions, such as things like patient assessment, exercise therapy, MSK manipulation techniques, and students become really accustomed to practicing on patient simulators and each other, but in a safe, really supportive environment to help you deliver effective treatments and interventions. We also have 2 separate clinical skills rooms, which allow students the opportunity to again learn those techniques and carry out those practical skills through simulated patient scenarios. So the clinical skills rooms can represent hospital ward environments or maybe a community setting, but they're equipped with all the support systems that are found in all hospitals, such as things like nurse call buttons, suction, oxygen, emergency resus trolleys, defibrillators, patient observation monitors. So here students again practice those essential skills for physiological observations as well. We also have the movement lab, which has a state-of-the-art quality system, which uses cameras and force plates to collect dynamic movement data. The movement lab allows a person's pattern of movement to be visualized and analyzed, so allowing things like gait impairments to be assessed by a biomechanical examination, coupled with gait assessment as well. And just to finish off, just to finally give you some further information on our staff and their professional links within the industry. Professor Michael Callaghan is a professor of clinical physio at Manchester Met. He's also a clinical specialist at Manchester Royal Infirmary. And he's also head of physical therapy for Manchester United and has been heavily involved with the FA Cup finals, Commonwealth Games and the Olympics. So hopefully this gives you an idea of the calibre of our teaching staff within the faculty as well. So that's a very brief introduction to physiotherapy from me at Manchester Met. If anyone has any questions or wants any more information, feel free to come and have a chat with me or request a meeting through the platform. I'd be very happy to hear from you and answer any questions that you might have. But thank you very much for your time today. Okay, we don't appear to have any questions so far. But as I say, if anyone does have any questions, feel free to come and join me on the platform. I'd be very, very happy to answer any questions that you might have.
Thank you, Catherine.
Thanks, Cynthia.
Yeah, so as Catherine mentioned, so if you guys have any questions, feel free to drop it in the chat box or Q&A, or you can also visit the booth after this session.